I want to tell you just a very brief story about my early practice, an example where this policy would have been helpful. My first job was in Marshfield, Wisconsin. It is a big hospital in a very rural community, and I worked overnights like lots of nurses do. I took care of patients on a 50-bed unit, patients with medical conditions like diabetes and heart failure and kidney failure and liver failure. And I was assigned one night with one other registered nurse on that 50-bed unit and a couple of nursing assistants. So we started the night understaffed. On that night, I had a patient have a cardiac arrest. It was the first time that happened to me. That was a memorable experience because I was in the room with the gentleman when he arrested, and I was the one who was first there to resuscitate him. When you call a code in a hospital, a team comes to care for that patient, but you have to stay with that patient as well. They're your obligation, they're your assignment, they're your responsibility. On that night, I also had a person who had recently been discharged from the intensive care unit. He was newly extubated. He had a breathing tube in his throat, and he'd had that for some time. They had just removed that breathing tube. They had discharged him from the intensive care unit where you have usually 1 or 2 patients. So when you're in the intensive care, you're getting a lot of attention from your nurse because there's only just a couple of people that you're caring for. He was transferred from there to a unit where he had me and one other registered nurse, and we had lots and lots of patients. He was afraid. He was afraid because it was the first time that he was on his own overnight, and he was afraid he couldn't breathe. And I had a patient that night who had a GI bleed, which means that she was bleeding from her bottom. And we needed to get her into surgery, and we needed to get the surgeons to come to do that work. I had those 3 patients along with other patients in one night. I worked in a rural community. We couldn't get extra staffing to come in that night. It took hours for us to get extra staffing to come in. We were beyond our limits at that point, and if we had had to accept an admission that night, it wouldn't have been safe. I would have liked the authority to say no. I didn't have that authority. We worked our tails off that night. I was a pretty new nurse. It was pretty scary. And if we listen to nurses, and those of us who are serving on the Health and Human Services committees have heard these stories, we all know that we have hard days at work. We do too here. But when the nurses are saying there are too many examples in which the staffing is such that we are not safely caring for Minnesotans, we need to listen to that.